Hi, we are live now. Hello and karibu. This is Himanshu joining you live from Zydushospitals in India. Along with me is my co-host Irene from Nairobi, Kenya. Dear viewers, thanks for all the motivation. Your comments are driving us to bring in medically and socially apt topics on the discussion table. Please keep writing to us with your views and we will keep following whatever you tell us. As we continue the series today, I'm going to share a secret about our brains. Our brain works like Bermuda Triangle. A lot of information goes in, but is never found again, especially when it's needed the most. Well, it happens with me. I don't know about all of you. And now you don't wonder why we are here conducting this session on brain health. Complexities of brain are unfathomable, and medics are still trying to understand it fully. So nature is nature, we can't match it. Our attempts to explore more about human body and the human brain continues. Our today's session shall unwrap the lesser known dangers of brain stroke. Brain stroke is the third leading cause of deaths in Africa as well as India. And yet there are many aspects of this deadly killer which can be either controlled or modified. We just need to be vigilant about the symptoms that we notice. The session chief today is Dr. Arvind Sharma, neurologist, stroke specialist, and a neurosonologist at Zydushospitals in India, and a very good friend of mine. Dr. Sharma, Karibu Sana, welcome the East African way. Now the virtual floor is with Irene. Irene, please take the session ahead, and I'll join you at the end of it. Thank you.
All right. Thank you, Himanshu. Of course, you know, the people know me, Irene. I'm your very able mentor, Patient Support Services Africa, a nurse coach. And as we keep talking about it, you know, it's better to prevent than to cure. So one of the missions that drives this Saturday meeting is that we are able to empower ourselves so we become expert patients. So that the next time we visit Dr. Sharma, we'll be asking questions that, you know, have power. Yeah, so as Himanshu said, we want to talk about brain stroke. And, you know, before we go down that road, I would just want to ask Dr. Sharma to give us a few, you know, a very short introduction about who he is, what he does, what your hobbies are wouldn't hurt, because sometimes people feel like doctors don't have hobbies. I'm sure you do. So, you know, tell us a bit about yourself and then we can move on.
Thank you. Thank you very much, Irene. Thank you. And you're doing a wonderful job. I've seen your last session and you're doing a wonderful job for the patient support service in Africa. Thank you very much for getting associated with us. And myself is Dr. Arvind Sharma. I'm a neurophysician with Zydushospitals and I'm a stroke specialist. My subspecialty is stroke, where I even do the neurosonology, that is the ultrasonography of the brain and the cervical region. And the interesting thing which you have asked me, that I'm also part of the Indian Stroke Association as a executive member and the treasurer, and I'm the president for the National Board of Education for the Gujarat. So as you asked about the hobby, we should all should do that, right? I should not disclose mine. You should also disclose yours, right? I believe in sports and I love to play all sports. I love adventure, right? I love nature. I love traveling. The first passion is traveling. Second passion is music and dance. So that is what my hobbies are.
Yeah, you're actually right. We all should say what our hobbies are. So for me, I am a nurse by day. By night, I could be a chef because I like cooking. So that is something. And we possibly share a common one around travel. I don't like the process of traveling, but I like to find myself in new places. So maybe someone can come up with a new way for me to get there, but not have to travel. Yeah. So Himanshu, you need to tell us what your hobbies are before we continue. That is the new rule.
Well, definitely, I'm a flautist. I play the flute. I love music. So Indian classical music is something which I live by. Cycling is something which I enjoy doing. And apart from that, I've been so involved in healthcare that assisting patients have been a part of my life, integral part of my life. So I'm almost living it now. So that's all that we have about. I'm sure people are bored enough for us to continue. Everybody wants to hear about stroke and not my hobbies. So I would give the floor back to you to start again.
No problem. All right. So Dr. Sharma, please tell us, what is stroke, and, can you simplify it for us? I was trying to get a feel of what people know about it or think about it in the support group, and everybody was. So please tell us, what is BrainStroke, and, in layman's terms, so we can understand it.
Sure, Irene. First of all, we have to understand that stroke is the word for brain. So it is a brain stroke, which is the term we have given. The brain stroke is the lack of blood supply to the brain. Brain is the organ which do not function if they don't receive any oxygen and blood. So that is why you heard anybody suffer a cardiac arrest and doesn't reach a supply to the brain, the brunt goes to the brain. Whatever heart do mischievous, the sufferer is the brain in the layman term. So brain is a sensitive organ that if the blood supply is not there to the brain, that area gets damaged. So there are two types of the stroke which can do that. Lack of supply can be because of the clot that goes higher up in the brain and obstruct that artery or the vessel, the supply. And another, the artery can get ruptured and you can have the hemorrhage. Both can cause a stroke. That is why that area of the brain is damaged.
Okay. So I'm trying to be the layman person here, and so the clot probably didn't scare me as much as the artery can get damaged and start bleeding. So what are the causes? What are the causes that lead to this kind of thing?
Very good question. It's very good to see what for the heart is. There is a lack of blood supply to the heart, you have a heart attack. Similarly, you have a lack of blood supply to the brain, you have brain attack. So both are vascular structure, heart and brain. So the causes are very much similar. The first 4, 1, 2, 3, 4 are hypertension, the high blood pressure, which we have to control. But it's a silent killer, right? You don't know what your blood pressure is. You feel that I'm feeling very hot, I'm feeling very giddy, my blood pressure is high. Everyone is saying that my blood pressure is high, but we don't check our blood pressure. We should check our blood pressure up to the age of 18 to know about our, in a health checkup, what our blood pressure is. The first and foremost cause is the blood pressure. The second, high blood pressure. Second is diabetes. Third is biggest in the young stroke, which is the most notorious, is smoking. And the fourth is high cholesterol. These are the things which are the most important as a cause of stroke. And as we tell all of us that we should exercise, the sedentary lifestyle makes us happy to have the stroke. So the active lifestyle is very much important to not to have any vascular disease, either it is heart attack or a brain attack.
Yeah, I mean, I can totally understand. As you were talking about hypertension, I remember there's a time I just asked randomly, when's the last time you checked your blood pressure? We rarely go to check those things. I don't walk into the facility and say, I'm just here to check my blood pressure, unless it's indicated,
Absolutely.
Yeah, so
you are very right about.
And I'm sure someone is seated somewhere thinking, so the people who already have an issue with their blood pressure probably keep checking it on a regular basis. So they would probably not be the ones who would suffer from this stroke. Then there's the rest of us who don't check because we don't feel the need to go and check it. And then that's how we end up suffering from the stroke. And that's why it's called a silent killer.
Absolutely.
Yeah.
Correct.
So the question I have for you is, you mentioned something about high cholesterol levels. Again, this is not something that we check on a regular basis. And so, how do we differentiate what is good for us and what is not good in terms of cholesterol? That is question number one. Number two, when everybody hears about cholesterol, we think of eggs. Is it true that they are not that good for us and that we shouldn't have them as much as we should,
So both the questions are very pertinent for any person can suffer a cardiac disease or the brain disease like a brain stroke, which is very devastating, which is very disabling. That is why stroke is very important. So the first question is about the cholesterol one. So there are good cholesterol and the bad cholesterol, right? The HDL, which is if you do a cholesterol level, HDL is a good cholesterol for our body, and LDL, the low density lipoprotein, is a bad cholesterol for our body. But overall speaking, this all goes to your diet. It all goes to your physical activity. So if you do a good physical activity, if you keep your diet very balanced, then I will come to your the egg thing which we have talked about, right? If we keep our diet good, we can maintain our cholesterol. But there is sometimes a point where the diet is good, even the you're exercising well, even the cholesterols are high. Those are known as the familial hyperlipidemia, where you should know that your family friend is low HDL, high LDL. So you in the family you know about it. So those are treated differently. And now talking about the diet you are talking, everything is important in diet. So excess of pleasure or bad is always you know about it. Excess is bad for everything. So
Yeah.
add in a certain amount. Diet should not be constricted or restricted to the certain food. Food should be balanced. It should include the protein, fat, and carbohydrate. We agree to build our muscle, we need protein. And we should know that we have another peripheral cardiac pump in our lower leg, right? Where all the blood is pumped back to the heart. And it is important for our brain also. So it all are interrelated. Exercise, diet, and a good food and a balanced food, eating all of them. If you eat 6 or 8 eggs in a day, you should know how much you have to exercise about that intake of the food. So you exercise well for that, and if you take out those input and output, which is known as, is very important.
Yeah, so it's funny that you mentioned about concentrating on a type of food, because I know, and maybe Himanshu has seen it or not, here in Kenya or in East Africa, we're very big on having red meat. We can eat it from today to 20 years from now. We'll just be eating red meat. Is red meat a predisposing factor on its own, or is it because you eat it very regularly? Does quantity matter in terms of the red meat?
You're very right about it. There are certain factors where people always claim about to take the white meat more, like you talk about the white meat, the category is fish, right? Where you have the proteins also, right? When we're talking about the red meat, definitely it intakes. People are taking the red meat from long, not from now. It's long back they are taking it. So how much you output, you do output with that red meat. But once you started developing risk factors like hypertension, diabetes, then you should focus on cutting down on those products where you are not able to generate that much of the insulin in the body to keep your blood sugar low. So it is all the cycle is very interrelated, as you see.
Yeah. Okay, I totally understand that. So output matters. So if you just eat and sit, then there's a problem. But if you do it in moderation and then find a way to exercise and be active, then somehow it balances out. Okay. So my last question to you is, medication. Is there any medication that can lead to stroke?
That is a very important question because there are blood thinners when you have to take for the cardiac part, right? And these are necessary for the atrial fibrillation. They can cause hemorrhage in the brain. That is very important to know of, right? There are drugs which are given to stop the bleeding, which can cause the thrombotic nature of the blood vessels. That can also cause the damage to the brain or the heart or other vascular structure. Otherwise, we should know more in the sense where you need to thin out your blood and when it is not to.
So how can we reduce the risk when we are on this medication? For some people, it's inevitable that they are on it, but what can we do that's extra that can reduce that risk?
So whenever you are on such medications, specifically for on the cardiac part, you should see your doctor very regularly, or you should see your neurologist very regularly, or your physician very regularly when you are put on such medication. This is not a one-time event, right? You consider it a hypertension or a diabetes or the cholesterol problem. You have to maintain that health checkup regularly to know about your risk, that you are overboarding that thing or you have overdone it. So you have to titrate your drug. Sometimes we have seen somebody is taking a medication and stop it after a year or two, saying that I don't have any problem now, I don't need any drug, I feel very good, I feel very healthy. So that is not the part on all the medication you are taking, and it is also very much related about the blood thinners also. So you should have a very regular checkup with your health professional, either be a nurse or a doctor whom you are seeing for.
Yeah, I think that's important, especially for pregnant women. There's a lot of fragmentation of care for pregnant women who are also having, hypertension or have a history of preeclampsia and all that. Then they're put on some medication and all they go to is, the clinic to be checked on how the baby is doing and your blood pressure, but nobody really ever checks, how is your, or your blood and all that based on the thinners or the other medication that you give it.
Irene, very good point you have made about that, right? Especially in the young women when they are on the birth controlling pills, which is very important to know about. Those are hormones. They can decrease the blood supply in your veins. So there they have to be very particular to know about that these medications are to be taken in a very supervised way. You have mentioned a very important point, and which is very important to everyone to know while you're taking those medications. And in those medications, I have seen one example. One young female was on those medications and was traveling back she was traveling as a tourist and came to our hospital, and it was a long flight. You are on that medication which are thrombotic, and then you don't move your legs in the flight. So the clot form in the leg and it can go to the brain and cause cortical venous thrombosis. That is another type of this stroke, which is very.
Okay. Thank you for that. That was, that came up as I was thinking about it. Himanshu, let me hand over to you. I can ask a million questions, but let me hand over to you.
It's going to be long if we just continue. There's so many things coming up as we talk. Well, I must thank Irene, you and Dr. Sharma.
Yeah.
You've shared some really crucial insights into identification and classification of stroke, which definitely makes people's life simpler. I would now be asking some questions which are personally close to me, since I have observed stroke patients in my immediate family. So I thought that this would be an opportunity for people to learn and understand from experiences that I have gone through. So, Dr. Sharma, how important is physical therapy in both ischemic as well as hemorrhagic stroke, as you have mentioned? I would also add one more small part to it, that how is there a duration for which the minimum duration for which these physical therapies should be supervised by a specialist?
Very, very good question, because stroke is not all about treating it when it comes to the window period. When the window period is 4.5 hours, if you have an acute stroke, and we haven't talked about the symptoms, I'll just brief that and go to your questions, all the three things which you have asked. That when you have an acute stroke within 4.5 hours, you come to the hospital, like our hospital, which is a tertiary care hospital, where you can get the thrombolysis, and even you can get out your clot from 9 hours or 24 hours. That is the acute setting. But not every person who is suffering a stroke can reach on time. And I will give you a very good example or missing the symptoms of the stroke. Like symptoms of the stroke are weak fast. B is for the balance. You move, your balance is not good. E is for the eyes, your eye vision can go away. F is for the fields, your fields can be deviated. And A is for the arm or leg, it can drift down. Then S is for the speech, you can have the slurred speech. And T is the time, which is most important. So these symptoms are sometimes missed and you are not able to reach to the hospital on time. Like I talk about one young CEO, 36-year-old, was very obese, and he was talking to in his office that he was asked, this is the thing where you live, and he was not able to answer that where you live. So he used to say that I live in Kenya and somewhere, and he was not able to, he was circumlocuted and he was not able to answer the right answer. So he was sent to a psychiatrist because he is the CEO, his family members of the field, that is in the high pressure that he should go to a psychiatrist, where he was given a psychiatric drug, and the next day again went to a second psychiatrist, then came to our hospital to see an emergency a psychiatrist. Then our emergency is very trained for the stroke. They identified it and they asked us to see the patient. So he was told, I'm looking for a psychiatrist. He's a CEO, he is very busy and he's very. So when we identified him, he was having a language problem, which is acute in a stroke, which is known as aphasia, where you don't answer the language question right, you circumloculate, and that is known as a jargon fluent speech as aphasia, and his parietal lobe, one of the part of the brain area, was damaged because of the stroke. So the thing has not finished. We treated him for the stroke. Then he told to us, there the question comes which Mr. Himanshu has asked about the physical therapy. So now what to do? He lost his confidence. He cannot go to the office. He told, I cannot speak. I'm not able to convey the things which I want to do as a CEO. So we did a speech therapy for him for 3 months. After the speech therapy, he gained the confidence and then joined his office back. So this is a success story not involving the identification of the symptoms, treatment, but the comprehensive approach of a physical therapy. That is very important. Now coming to the different symptoms in the stroke, the physical therapy for the arm and leg weakness, which Mr. Himanshu was talking about, in the ischemic and hemorrhage. Hemorrhage, it takes time and it is sometimes not completely recovered. And the second ischemic, it may recover fully sometimes. It depends on the type of the stroke and what area of the brain is involved. Now coming to the duration of the therapy. So as soon as possible, you should early rehabilitation, it is known as, you should start the physical therapy as soon as possible. And as you do that, the first 6 weeks to 3 months are most important to do a aggressive physical therapy. And it is not only you, not only the doctor or the nurse and the physiotherapist who is doing it, the patient should be motivated for doing it, because until he will not develop a plasticity. Brain is a funny organ, right and left brain. You have a bridge which is known as corpus callosum, which helps to develop a neuronal plasticity, where the other side of the brain can take the part of the damage area on the other part, which is very important. But the duration, I tell you, it is lifelong because of that neuronal plasticity. You should not lose the hope. I've seen people improving completely even after 2 years of their stroke. That is about the duration.
Fantastic. I mean, this is a very encouraging thing for all of us, the viewers, for me personally as well, that do not give up on physical therapy. Do not think that exercises are not going to help. It may take time, but it will surely be of assistance. Thank you, Dr. Sharma. My next question, the last question of the session, but equally important as well. Does exercising at home, because Africa, India, both have an environment which is socially very close-knit. So does it help as much as a professional physical therapy after 3 or 6 months would help?
Very good question. And I think Irene knows about it because she's dealing with that patient support group. And she knows how much is it is important as the patient family to support it. Because not everyone, see, if you go in West, I've done my fellowship from Canada. So whenever there is a stroke, they go to the assisted living and they have a coverage from the Canadian government and they can do it. But the countries like India, countries like Africa, right, where you are doing the Irene, the patient support group, so those areas you cannot do the continuous physiotherapy by the physical therapy. You learn from them, and that is the beauty of the joint family, what these countries are, where the family members are the part of the team and they do the physical therapy. And one of the trials in our part of the world, it was done where the Australia was also involved, Africa was also involved, India was also involved, where it was seen like in the West, the physical therapy is done by the professionals, and in India and these countries are done by the home people and by their family. So it was found that the people from the home done as physical therapy at home by the family members improve faster than the people who are doing at the assisted living. So that is, you know, that emotional EQ touch, the emotional touch
Yes.
is very important in treating the stroke. So it is not only that only the mechanical thing matters. It is you may be doing in a wrong technique, but if you learn from a physical therapy, long-term physiotherapy should be done with the family members, and that is why the family matters.
Thank you, Dr. Sharma. So the emotional touch to the physical therapy makes phenomenal difference. It's not just about physical therapy, it's also about how much can you give in emotions, motivate a person, and drive further. So friends, this is all we have for today. Take care of yourself, reduce stress, sleep well, that's very important. Don't overthink and eat healthy. And don't forget to join us next Saturday, September the 19th, same time, same place, as we take up another interesting topic, diabetes and your love life. I'm sure people would not like to miss that, right? So be well, stay safe. Goodbye from Irene, myself, and Dr. Sharma. Thank you very much.
Bye.
Namaste.
Thank you, Irene.
Thank you.
Keep doing the good work. Thank you, Himanshu.